College of Dental Science and Hospital, Amargarh. I extend a warm welcome to all dignitaries, staff members, dear students, and all participants joining us today. We are gathered here to observe World No Tobacco Day, celebrated every year on 31st May, to raise awareness about the harmful effects of tobacco use and to encourage people to adopt a tobacco-free lifestyle. Today's webinar, under title Unmasking the Appeal, Countering Nicotine and Tobacco Addiction, is a step towards the important mission. To begin the program, I respectfully invite Dr. Pankaja Shipai, KMM, Principal, College of Dental Science and Hospital, Amargarh, to grace the occasion with her valuable words. Ma'am, kindly address the gathering.
Thank you, Dr. Maitri. Am I audible?
Yes, ma'am. Yes, ma'am.
Am I audible? Yeah. Yeah. A very good afternoon to one and all, and a warm welcome. And at the outset, on behalf of College of Dental Science and Hospital Amargarh and KJ Mehta TB Hospital Trust, I'd like to acknowledge the presence of our own guest speaker for today, Dr. Mayur Mishra. And we are indeed thankful to you for readily accepting the invitation of Dr. Mandip and for making this session happen. Thank you so much, Dr. Mayur. And as you all know, today's session is the continuation of sequence of events that are happening in support of the appeal by the National Resource Center for Oral Health and the Tobacco Cessation, Maulana Azad Institute, and National Dental Commission, Ministry of Health and Family Welfare, in order to create awareness of the hazardous effect of the nicotine and the tobacco products, especially amongst the youth. And I'm indeed thankful to the Tobacco Cessation Center of our institute, run by the departments of oral medicine and radiology and public health dentistry, headed by Dr. Pranay Patel and Dr. Mandip Singh Goel, for the sequence of events that they have been organizing so meticulously, and for making this session also happen in order to reveal that we are in support of the statutory appeal. Thank you so much, Tobacco Cessation Center, headed by Dr. Pranay Patel, Dr. Mandip Singh, and their team. And on this session, let us say no to tobacco and yes to life. And hope today's session will be enlightening. Thank you. And over to you, Dr. Mandip, to introduce our guest speaker for today.
Thank you, ma'am. Thank you, ma'am, for your inspiring words and encouragement. We are grateful for your guidance and support. Now, I would like to invite Dr. Mandip sir, Head of Department of Public Health Dentistry, to introduce our esteemed speaker for today's webinar, Dr. Mayur Mishra sir. Dr. Mandip sir, please proceed.
Good afternoon, all. It is my honor and privilege to introduce our esteemed guest speaker, Dr. Mayur Mishra sir. Third degree is Masters in Public Health Dentistry from Vaidehi Dental College and Research Center, Rajiv Gandhi University of Health Sciences, Bangalore, in year 2017. Sir began his academic journey as assistant professor at our own institute, College of Dental Science and Hospital, Amargarh. Currently, he is an associate professor in renowned Government Dental College of Jamnagar. Sir has 80 publications in various national and international journals. He is also reviewer of various national and international journals. He has distinct number of copyrights and patents to his name. He was nominated in Youngest Research Scientist category by VD Foundation of Vishakhapatnam in year 2021. He won the Youngest Research Scientist Award for research category in medical and dental health.
I think, Charmy, your mic is off. I think I couldn't hear you.
Dr. Vayu, sir, the virtual platform is yours.
First of all, I would like to thank College of Dental Science, Pankajakshi ma'am, Dean ma'am, Mandeep sir, who was like my mentor for academic, Mohsin sir and Pranay sir, who are senior, who helped me throughout my this career. Thank you, sir, for providing me this opportunity. It is my honor to be a part of College of Dental Science before, and I will still consider myself as a junior to you. And I would like to be introduced like junior to Mandeep sir. It is my privilege, sir. So let's start today's seminar. The theme was given to me was Unmask the Appeal Tobacco Expose, or WHO says is Unmasking the Appeal, Countering the Nicotine and Tobacco Addiction. So before going in detail about this program or about this seminar, I would like to brief about why they have selected this Unmasking the Appeal, the Countering Nicotine and Tobacco Addiction. So everyone know what is tobacco, what is ill effect of tobacco, but I would like to brief it. Like tobacco is the second most common cause of preventable disease. It caused 8 million deaths throughout a year in worldwide. Now see 8 million deaths, but someone means the tobacco industry sees this 8 million person or that individual as their customer who has lost the follow-up of their company. The tobacco industry has understood this cycle. Okay? Each year we unfollow or each year we lost 8 million of population each year. And this cycle they need to continue. So what they are doing, they are advertising their product to a younger individual so that they can get each new customer each year. Means the loss of follow of 8 million will get next year by upcoming or registering new in their what it called death note of tobacco industry. Mostly what happened, the tobacco industry, how they appeal to individual. Before it used to be like newer design, newer lighter, or the advertisement signing a new hero for this photo. But now the younger generation, they are towards social media and they think the old goodies were too old. So they need something new. So what they have designed this nowadays, something which is less harmful. It looks less harmful. It is harmful only. and something which is like more acceptable in like taste, in packaging, or maybe in design, or it should be look cool. So this is how they are like marketing their strategy or reinventing their strategy to register their customer in their enrollment. So let's see how tobacco industry has occupied now. So in this seminar, we will be dealing about, I would like to say, this seminar will deal in two parts. The first part is tobacco, their effect and their newer product. And the other part is our main part, which is unmasking the tobacco industry and the tactics. So let's introduce about the tobacco. The tobacco and nicotine cause 8 million of death. In this 8 million of death, I can say the most of the individual are suffering from systematic disease or some local lesion. The local lesion mostly are oral cancer, lung cancer, or the other type of cancer. If we see properly, around 28% of individual who smoke or who use any type of tobacco in any form. But out of that, this 28 people, 55% of individual are willing to quit, but they don't have any idea how to quit. They don't have why they are craving for this cigarette or tobacco product. The main mechanism what tobacco like act is nicotine. Now everybody knows about nicotine. There is nicotine in every product of tobacco. But what is this nicotine? A nicotine is psycho-addictive drug or a material which cross your blood-brain barrier and which cause your brain to induce or to develop a addiction which can crave for the cigarette every time you smoke or every time after certain hour. Other than that, the tobacco has 7,000 of chemical which directly or indirectly can harm your health. Nicotine danger. The nicotine is actually a type 1B toxin. Now, what is type 1B toxin? Type 1B toxin is there is no safety dose for it. Means in a lethal dose or in a smaller dose, it can induce harm to body. It is said that around 70 milligram of nicotine can lead to a death of a person, of a healthy individual. But nicotine in a cigarette is very small amount. So what it mainly causes addiction. The rest are like cardiovascular issues, pregnancy issues, or pregnancy related risk. These are like related to tobacco's other product, which are chemical. But the main issue is here is addiction. How tobacco works? So tobacco has mainly two categorized material. The two categorized material are first is nicotine. Nicotine is a brain stimulant, or I will say a psychoaddictive material. Now, what happens when you smoke a cigarette? Within a seconds, 2 to 7 seconds, nicotine reach brain by crossing blood-brain barrier, and it causes a craving or addiction for the same substance. But by this time, when you were smoking, there are other material which are the chemical or byproduct of tobacco, which are doing some other work. And this work is your systemic illness, systemic harm, or maybe your oncogenesis. So cardiovascular system, when you smoke tobacco or when you inhale tobacco product or when you chew tobacco, mostly I'm talking about the smoke tobacco. It first stimulate your blood pressure. What happens when you smoke? It goes to your lung, alveoli take up it combines with hemoglobin. And now what there does, it goes to systemic circulation and it leads to a triggers of adrenaline. Now we remember in physiology, the adrenaline was fight or flight hormone, means body thinks you are in stress. So it will reproduce or it will release epinephrine. Now what epinephrine does? Epinephrine will do continuous vasoconstriction of small blood vessel. Small blood vessel are throughout present in body, but mainly it affect brain and heart, where it can lead stroke of heart or stroke of brain. The next mechanism is clotting. Whenever there is a nicotine or nicotine like a product or nitrosamine, what they do, they elevate fibrinogen. Now, if you see clotting mechanism, fibrinogen was the one to initiate clotting of blood vessel. It initiate aggregation of platelet. Now, this elevated fibrinogen increase thickness of blood and which can lead to clotting. This is further can lead to atherosclerosis or otherwise stroke. Now, there is one more thing which is called vascular damage. Continuous vasoconstriction and nitrogen oxygen species, which is NO2 or reactive oxygen species. What they does, they directly act on small cell of the tunica alba, tunica media, which is present in blood vessel, and that lead a vascular damage. Other than that, if we smoke like cigarette or bidi, which are smoke type of tobacco, what they lead a respiratory problem and a cancer. The respiratory problem mostly start with the cellular DNA damage. As I already told, there are 5 to 7,000 non-chemical agent present in a 1 gram of cigarette or one like pellet of cigarette. Among them, there are 67 carcinogen, which can easily affect alveoli or lungs or oral cavity or esophagus. Other than that, there are as I told, reactive oxygen species. Now let's brief about reactive oxygen species and nitrogen species. They are free radical. In a short term, they are free radical. Now, whenever there is a free radical or free electron, it can combine with anyone. And what it does, it mutates cell or mutate DNA, which lead to a tumorigenesis, which is the formation of tumor. Other than that, there is a continuous tissue destruction. Alveoli, cilia are the part of lung. What they does, alveoli produce mucus and cilia transfer that mucus to all the part of lungs. Now, what this smoke or tar of the cigarette does, it destruct cilia, it destruct alveoli, and this is how the mechanism of tumorigenesis or damage starts here. Other than that, this was about how the smokeless tobacco can do. And if the form a smoke tobacco can do, if the smoke tobacco affect respiratory and cardiovascular system, there is other type of tobacco which can lead to a damage at a local organ, which is smokeless tobacco. Now, the smokeless tobacco, what are they? I will deal in the next slide. The most common thing or most common systemic problem they can lead or local problem can lead, that is oral cancer. Now, oral cancer is one of the 10 leading cancer in India. In India, it constitutes around 30 to 35%. Oh, sorry. In global scenario also, 30 to 35% of cancer are considered as an oral cancer. The most prevalent among them is squamous cell carcinoma. It is said that it is among the 30% of cancer in India. And other than that, the incidence is highest among the cancer, which is 12.6 per lakh. If we talk about Saurashtra region, so let me remember around when I was in Amargarh, we and like Mandip sir has done a study and we have published it through our department. The public study was on oral submucous fibrosis patient or the patient who are chewing supari or areca nut. So we found out that the oral submucous fibrosis was around 8 to 12%, and which is like 8 times normal, 8 times higher than the normal. The normal is 1 to 2%. And in Saurashtra region, only Bhavnagar region, we found out it was around 12 point or 8 to 12%. So Western India, mostly the Saurashtra region, the 8 district and now the 11 district of Saurashtra become a hotspot. Before that, it was Mumbai and the Western area, but now the registry has developed. So we come to know this region, means our region, the Saurashtra, has become a hotspot due to smokeless tobacco. And you know what type of tobacco? It is Mawa. Every time we see there is like a 5 out of, I think, 10% or 4 out of 10% are using this Mawa form. And this Mawa is leading to OSMF, leukoplakia, tobacco pouch keratosis, and other lesions. Sometimes what happens, they come to dental clinic or come to any doctor or like any relative and they suggest him this is the pre-cancerous lesion or these are the pre-symptom that can lead to a cancer. But approximately 50 times they go undiagnosed. They directly come on the last stage of cancer. Let's see impact of tobacco on oral mucosa. Before going in detail, let's see a normal mucosa. Normal mucosa, very pale, pink, sometimes there is a melanin pigmentation. Floor of the mouth, vestibule, and below the tongue. These are the part where a tobacco chewer or the mawa chewer used to keep their tobacco or their mawa. So while examining, just focus on this part and then go for palate, tonsil, and other part. Whenever you see a stained tooth, check for buccal mucosa, check for a floor of mouth. Definitely you will see some lesion. The first is tobacco pouch keratosis. Whenever there is a tobacco use, there are chances that tobacco induced keratosis. It is just a corrugated lesion which like blanch on like stretching. It is easily seen in vestibule. It looks like a wave of water or wave of sea. The other lesion are leukoplakia, whitish homogeneous type of lesion which is not scrapable. The other lesion is erythroplakia. This erythroplakia, what it does, it has higher chance of turning into malignancy. Wherever erythroplakia cases are there, just advise them for biopsy. For any reason, we need to advise them for biopsy. But the erythroplakia mostly present in the floor of mouth. there are higher chance, I think 5% higher chance of erythroplakia to turn into squamous cell carcinoma. So whenever you this type of case, ask your like a specialist or ask your guide, sir, this type of case I am seeing, if we can, it is possible to send them for a biopsy, or what treatment or what modality we can offer. The other lesion which follows is the major reason, which is I will call oral submucous fibrosis, which is most commonly present in our Saurashtra region. This all the lesion has chances of turning into malignancy, but last two I'm telling you, these are the highest chance of turn into malignancy, and these are the highest prevalent type of lesion found in our Saurashtra region. The other slide I'm showing you type of oral carcinoma. Mostly the oral cavity, they are suffering from two type of carcinoma. It is squamous cell carcinoma and varicose carcinoma. Varicose carcinoma doesn't have that much etiology related to tobacco, but the squamous cell carcinoma, which is very aggressive type of carcinoma, and which is has higher incidence of metastasis among body, are higher chance after tobacco or mawa chewing. So these are affecting like gingival, tongue, lip, and the floor of mouth. The most common type which we are finding in Saurashtra are this type which is related to tongue or floor of the mouth. Not only local tissue, there are tissue which can indirectly or directly can get affected by smoke or smokeless tobacco. Let's see one by one. The first are cancer. The most common cancer, squamous cell carcinoma of head and neck. I'm using word head and neck, but it is related to oral cavity. Outside it called basal cell carcinoma. The next is whenever this squamous cell carcinoma metastasis in any part of body, mostly lymph node, mostly lung, it can destroy lung or the lymph node, and it can metastasize in other part of body as a malignant lesion. Other than that, when there is an oncogen or mutation, it can lead to a leukemia. Now, there are certain type of cancer I have mentioned here: stomach cancer, kidney cancer, pancreas cancer, colon cancer, bladder cancer, and cervical cancer. So these are not directly effect of tobacco. The study and meta-analysis, you must multiple type of study. And when we combine this multiple type of study and conclude as one result, it says that when you smoke more than 40 cigarette per day, 40 cigarette, 4 cigarette or 4 BD, 40 cigarette or BD per day, it can damage to your stomach. Stomach has something called H. pylori bacteria, and now the cigarette effect can combine with H. pylori bacteria, and that can lead to a stomach cancer or colon cancer. Regarding in kidney, pancreas, and bladder cancer, it is suggested that the chronic smoker more than 20 years, smoking 40 cigarette or more than 40 cigarette per year, there's a definite chance that can lead to this type of cancer. Other than this were the cancer. Some people says, "Meri dadi, mere chacha 100 साल से smoke कर रहे थे." They couldn't get any type of cancer. They were healthy enough. But it is not about cancer only. There are some systemic disease. Sometimes it go undiagnosed. The systematic disease mostly are chronic disease. The first is stroke. As I told, the impact of tobacco, which was mechanism, stroke are due to the viscosity of blood, due to atherosclerosis led by the tobacco or smoke tobacco use. Other than that, it can lead to a retinopathy. The same we saw in diabetic retinopathy, or there is a decrease in lumen of small blood vessel can lead to a blindness of retina. Other than that, gum infection, which is very common, and that's why we are the first healthcare worker who diagnose this type of problem. Heart disease, pneumonia, lung disease, asthma, these are very common effect of cigarette. But other than that, for an Indian, like a middle or developing country, I would like to say the tuberculosis has a prevalent that a smoker who smoke a cigarette can lead to a tuberculosis threefold higher. Means the tobacco smoker has chance that can lead 3 times higher of higher chance of tuberculosis than a normal individual. Other than that, the study says when you start smoking at young age, around your 18s, there are chance of reduced fertility. There are chance if 20 to 40 cigarette per day or 1 pack per cigarette per day can lead to infertility. Other than that, study has suggested that it can lead to a osteoporosis. Now, osteoporosis is the condition where bone become brittle, bone become porous. So this can lead to a hip fracture in women. These are the effect when you smoke a single hand smoke. Now, let me introduce what is single hand smoke. When you smoke a cigarette and you are the only consumer of cigarette, it is called as first hand smoke means you smoke a cigarette, you inhale the smoke. But there are some other type of cigarette. It doesn't like when you smoke a cigarette, it doesn't like you smoke a cigarette, it will affect you. Means I have seen some teenager answering, मैं smoke कर रहा हूँ, मेरे पैसों से कर रहा हूँ, आपको क्या है? When you start earning, you will start telling your family also कि मैं smoke कर रहा हूँ, मेरे पैसों से कर रहा हूँ, आपको क्या है? But tobacco does not affect you. It affect your surrounding also, it affect your family also. Let's see some new terminology which was introduced in recent past last decade. The first is second hand smoking. It is also known as passive smoke. So what is it? When you smoke, there are people around you, many, your friend, your children, your brother, sister, or family member. When you smoke, the smoke goes inside your body, but the outer part of small like cigarette, it liberate a smoke which goes in surrounding, which is like inhaled by the surrounding people or surrounding woman or family member, and it is more dangerous, or I will say it is dangerous than what you smoke, because whenever you smoke, you have filter. The filter smoke is going in your body. But whenever the people who is smoking your passive smoke is actually directly exposed to these cigarette smokes, and which can lead to more harmful effect to their body. Mostly passive smoking can lead to a premature birth in pregnant women. Most of the time what we have seen, घर में जो दादाजी या कोई बड़े होते हैं वो स्मोक करते हैं, nobody has that guts to ask him कि आप बाहर जाके स्मोक करिए या कुछ करिए. और घर में जो सबसे छोटा होता है या सबसे छोटे जो बच्चे होते हैं या प्रेग्नेंट वुमेन होती है, that are get affected by this type of smoke. So this is known as second hand smoking. Means you are smoking, but your surrounding, the people, they are passively smoking your smoke. The next is third hand smoking. Now I have smoked, or some people have smoked, but they were sat on a chair or sofa, or they were in a closed room where they used to do, okay, मैं smoke कर रहा हूँ, उसकी ash नीचे गिर रही है. The ash is like they are reducing their ash downstairs only. Other than that, there are curtains which takes the nicotine and the tar and the carbon monoxide very easily, and that stay in that surrounding for some time. Mostly it says it stays there around 12 to 20 hours. Now what happens? It can lead to a nicotine-leaded dermatitis. Mostly in children, it can lead to a dermatitis. Other than that, the children gets habit to for that smoke, and they will realize, okay, it is good. The smoke, I'm liking this smoke. I love to be in that smoke type of area. So this can passively aggregate or passively enhance their behavior toward taking a smoke in the future years. Other than that, a newer concept or fourth hand smoking. This is not a direct effect of smoke. You can see here in picture, there are birds, there are plastic cellophane paper, which after Mawa, they throw everywhere. In India, Swachh Bharat program or other program, we are leading in Swachh Bharat program in Gujarat. But yes, I can see cellophane paper. I can see the birds which are lying everywhere. And these birds, first, cigarette butts and cellophane paper are polluting our environment. Mostly the birds, the fishes, or the walls. And this is called fourth hand smoking. It doesn't directly affect your body or doesn't directly affect, but it affects environment or surrounding of your part or family. Other than that, one more newer concept. This is called green tobacco sickness. Please remember this word. These are the newer study, and people are planning to be conducting this study in our tobacco prone area. I will tell which are the area. The green tobacco sickness. Just see this picture. You can see this hand. These are the blackish brownish hand due to some work. Now, what is this work? I will tell you. Whenever the tobacco grow and their plant grow, the tobacco growers, what they do, they call harvester or laborer. Now that laborer and harvester, they pluck it by hand without gloves. So their skin, they get contaminated by tobacco, continuous friction with tobacco leaves and tobacco product and inhalation of tobacco product are directly absorbed to skin. Nicotine has chance, it can get absorbed by the skin, and that can lead to something called green tobacco sickness. Now, what are the symptoms of this green tobacco sickness? So I will tell, the first is headache, difficulty in eating, sometimes nausea, vomiting, weakness, fluctuation in blood pressure, chills and rigors or difficulty in sleeping as last. But I will say these are the main: headache, vomiting, nausea, and weakness are the main reported abnormality with this green tobacco sickness. This study was done in Andhra Pradesh because Andhra Pradesh is also one of the most cultivating tobacco industry. Other than that, we are planning to do this study in Gujarat area. We know the Charotar Pradesh, mostly related to Naryad and Dharmaj area, that this type of cultivation and this type of green tobacco sickness can be found. Other than that, there are environmental hazard. This is very less hazard, but yes, it is affecting our environment. The first I will start, whenever we pack tobacco product, we know BD, it comes from the leaves of timru. Even the cigarette, the paper around cigarette, the birds, it is get converted from tree or leaves of the tree or the bark of the tree. Now, millions of the tree are chopped because of this processing. Other than that, large amount of smoke containing CO2 and toxin are liberated in the environment, which is other causes second-hand smoke, third-hand smoke, or fourth-hand smoke. Let's come to a newer concept. Now, everybody has seen, I think, that is something called vape or something called e-cigarette or what we call smoke. So these are battery operated device which tobacco industry has introduced in younger generation. Now, while smoking, they suggest us it is less harmful. But what I say, whenever you have that plastic device in your hand, you discard it after some time. It has LED battery. It has volatile carcinogen. It has other nicotine factor. It has glycerin, which can blast anytime. So this can lead to an environmental hazard in future or after some time. Other than that, E was generated from these lithium batteries or e-cigarette. First, what we were thinking only computer and mobile phone generate e-waste, but now we got something newer enemy. This is called e-cigarette, which is generating too fast because 15 million of population is using this e-cigarettes. Now, when we used to study, there were only two type of tobacco: smokeless tobacco and smoke tobacco. It was the traditional classification. And whenever the question was asked, we used to tell smoke tobacco, smokeless tobacco. But now these old goodies were too not that cool. For younger generation, that is like, कौन हाथ में पकड़ के cigarette फेंकेगा, कौन बीड़ी के ऊपर, अच्छी चीज है, you should not smoke, but you have started something. I would like to tell staff this younger generation knows about these goodies, but we don't know about it. So please focus on this slide because I have seen some of my students sneaking these items in my class or in practical hours, and they doesn't smell or sound like cigarette products, sir. So first, the traditional classification, smoking tobacco. I'm not going in detail, just picturizing it, what is like it. The first is hookah. Hookah was started in India in a Mughal time. But the Mughal were too smart. There were their court and there were the people in court. They used to tell them, if you smoke directly, it will harm your body. So what you do, you pass it through some water bottle and it will calm down the effect or it will reduce harshness. So they started with this hookah, also known as hubble bubble. Then it comes to cigarette. Like somebody told BD is too harmful. Put one filter in behind it. So they started cigarette. But the traditional, the cultural effect was also found in this. If we see in Bhavnagar, only Mandip sir only showed me this hukli. So Bhavnagar, people used to smoke a clay pipe. It is made of clay or either wood, and they used to pour tobacco in this type of packet, and they used to smoke. 1 puff, 2 puff was enough, but it was direct inhalation. Other than that, cigar, BD are traditional use or cultural acceptable tobacco smoking type of tobacco use. But I would like to focus here something called e-cigarette. E-cigarette, newer concept, started almost in 90s, but popularized in I will say 2010 and 2020s. The younger generation, it become favorable. The e-cigarette, no, how they started, the people are started smoking too much. It was become tobacco maniac. So what they did, we have some device which delivered nicotine without delivering tar and without delivering carbon monoxide. People were too happy. Oh, what is it called? It's called e-cigarette. Oh, let's start with e-cigarette. No, but it doesn't taste good. So what should do? Add some taste in it. So younger generation also started. Oh, but it doesn't look like cigarette. Oh, it is very good. We can sneak out somewhere or anywhere. So they started it using more and more. And this is how the industry has grown from a single cigarette, which is started by RJ Renault, and now it is around 40 million people directly or indirectly, or just for a chance or just for, I want to check what is it, they have used a e-cigarette. Other than that, there are smokeless tobacco. Everybody knows, but I would like to focus here, Mawa. If we see this younger generation, what they have done, they have not used the smokeless tobacco that much because they doesn't found it aesthetic. दांत खराब हो जाते हैं. They don't care about cancer. दांत खराब हो जाते हैं. we don't like to spit everywhere. So they have not inclined toward this type of tobacco. But for our purpose, the most common is Khaini in Bhavnagar or Saurashtra area, Mawa, which is mixture of Shopari and tobacco and lime. And it is more dangerous form, I would like to say. Other than that, this is Gutka, which is marketed as pan masala, but there is tobacco in that. And other than that, the snuff, which is like snuff, but some other products are also there, like snuff, toothpaste, which are marketed as a smokeless tobacco. And I would like to say this tobacco's list is I cannot enumerate this list. This is the big list. So the newer classification is called NENTP, which is New Emerging Nicotine and Tobacco Product. It is also known as e-cigarette, also known as AND. AND stands for electronic nicotine delivering device. Okay, if you see this design, you can see, look, it was started as a cigarette, then they have modified it in a pen, then pen 2, it is like something like cool, almost colorful pen, then a vape like a design, then a cigar like a design, but they are all electronically planned nicotine device. They have targeted younger generation and all the generation. For older individual, they have like made like cigar and pipe. For younger individual, they should not get caught, or they should like feel less harmful, or they should have a social desirability. They have planned it like a pen type of device. But the generation has changed. Now what they are planning, first generation was e-cigarette. Then they have planned something called clearometer. Now clearometer means what, the name suggests it will reduce nicotine from your body. That's why the second generation called clearometer. Then the third generation came in 2010, which was toy pod. First, it was used like mode. Mode means, I would like to say, the square like a device which you keep in mouth like a whistle and smoke. This was known as mode. But now they have like increased their frequency or increased their reach to the people. They have planned like making this device like a toy, means the famous toy, the SpongeBob, or what is this called, Bobcat type of device. So younger children and with flavor. So younger children are more attracted toward this. Other than that, there are something called heated tobacco product. Now, these heated tobacco products are customly designed, and this same tobacco will be there, or tobacco in liquid form will be there, but you don't need to burn it. They have advertised it like don't burn, just heat. Means you will just get a vapor of nicotine, but it is same harmful as cigarette. Talk about the e-cigarette. The e-cigarette had rechargeable battery, which radiate too many radicals. Other than that, they have LED light, which shows you are smoking or not, or it also give a pleasure or sensory pleasure that you are smoking something and light goes off or goes on. It has a vapor device which has filter. When you inhale, the filter like pass the smoke to your mouth. Other than that, there is an automation chamber where you need to click, or you need to push the button. And there is a nicotine cartridge which contains propylene glycol, propylene glycerol, nicotine in a liquid form, and sometimes a tobacco itself. Mostly now all the company are supplying nicotine as a serum or salt or analog. But this propylene glycol and propylene glycerol are the same device which are used in blast to fire the cigarette or to produce the smoke. So this e-cigarette has disadvantage. They can blast anytime whenever you hold it or whenever it is in a mouth. Then please staff take care of this thing. These are the new pouch, which new nicotine device which I come across when you have like allotted me this seminar. Something called nicotine pouch. So Velo company, it is European based company, Zen company. Please student, don't try this. It is available in India in a black market. My purpose is just to create awareness, not to advertise this product. This nicotine pouch, what they do, sir, they directly contain nicotine in a flavored form, and they use it below the tongue or below the above the vestibule or below the vestibule, and it liberates a flavored nicotine throughout 1 hour or 2 hours. And this pouch, sir, in 2010, it was like 24 million pouch they have sold it according to RJ company or Renault company. In 2024, they have around 50 million of nicotine pouch sell in 2025, which shows 200% increase or 2 times fold increase in their purchase or sell. This nicotine pouch directly affecting the mucosa, directly affecting the psychoaddictive elements of the brain. And we can see it is affecting behavior also. The people who are using this pouch, there is study which find out they have mood disorder, like a bipolar mood disorder. Other than that, the same pouch also known as tobacco snus. These are same pouch they keep, but they have pure form of tobacco, not a nicotine form. This is the new type of tobacco. When I was online, I find out nicotine hand gel. This nicotine hand gel, what you used to do, you have to pour it like a sanitizer in hand, rub in your hand and just inhale it. And it lasts for around 0.8 ml of application, lasts around 2 to 4 hours. Other than that, tobacco gummies, these are chewable tobacco gummies, which like stand for 2 to 3 hours. Other than that, something called oats and pellet. Now, this oat and pellet has two type of work. You can directly keep in mouth like a lollipop, or you can just use your nasal area to smoke it, or you can put a patch in your buccal mucosa. Other than that, I have come across a product which is known as nicotine-based beauty product. I didn't get a picture, but I just got an article in newspaper. A nicotine-based beauty product. The girls or the boy which use Vaseline or lip gloss, it contains nicotine, means they have made it like a nicotine with flavor and fragrance. And they use the nicotine so nobody gets safety in a social area or like a school or college. So please don't try. These are just product I'm to increase the awareness among you. They are again classified as a heated product and unheated product, which liberate pure nicotine base or tobacco base. The heated product mostly based on the tobacco, whereas the nicotine product, they only contain nicotine salt and analogs. Other than that, this all product what you are seeing or what we have like talked now, this is made by some company called RJ Reynolds. This is the first company, America-based company, which started in 1885 and which frequently engineer or frequently market this type of product, and these products are approved by FDA. Means they will market like these are the nicotine delivery nicotine delivery product, so which can stop smoking craving. But it is totally wrong. They are like this. They are taking us in a wrong direction. They are marketed as a nicotine product, but now they are using as a replacement. I think substitute of tobacco or substitute of cigarette. So what is the difference between them? Heat not burn contain direct tobacco, e-cigarette contain vapor or salt. They don't contain tobacco leaves. Snus are tobacco pouch and the nicotine pouch are nicotine pouch, but they only contain nicotine in a direct form. The advantage of these are noise, no smoke, and there are less chance you will get caught by your superiors, family, or other friends. So is the addiction is real? This all thing can do addiction to us. So I will like to say addiction is real. And how it does nicotine act on dopamine? Now, what is dopamine? Just brief, I will brief about it. Dopamine is one of the endorphin. Now, what is endorphin? These are the hormone, I would say, or these are the neurotransmitter which increase your happiness in a normal word, happiness or your satisfaction. Like example, we have provided you a extraction case. भाई ये difficult extraction case है, just do it. जब आप वो extraction without help of your superior कर लेते हो, तो you feel like, oh, satisfaction. I am surgeon now. This satisfaction आता है, that is very good. The nicotine does the same thing to a body. It induces reward mechanism. It causes euphoria and pleasure feeling without doing anything. Means I have given you some task. कल सुबह तक आपको ये करना है. You know it is very difficult task. I cannot do. But what? You smoke a cigarette, nicotine goes to your body, and it gives you false alarm that you have completed your task. Now you need to stress it because dopamine has already released from the body. But it stays. It starts from 7 to 10 seconds, and it stays for only 1 hour to 2 hours. So let's see the mechanism how nicotine acts. So nicotine, when you smoke, it directly goes to your blood. Blood directly goes to brain. But sometimes what happens when you smoke, there is a nasal mucosa, oral mucosa, which directly take this nicotine and it takes it to brain. In a brain, it closes blood-brain barrier. Now, blood-brain barrier, as soon as the blood-brain barrier is crossed, it acts on neurotransmitter. First is acetylcholine, and then it is dopamine. Now, dopamine, once a dopamine release, it induces the same mechanism as I told, reward mechanism, calmness. you feel stress free, but it is only for 1 hour. And again, after 1 hour, what it start jumping to get that type of dopamine. Again, it start to increase that dopamine level, and you start with the second smoke. Dopamine levels reduce your leading or withdrawal symptom or stress and anxiety for certain time, but it has effect for certain level of time only. Other than that, सेम चीज आप बार बार करोगे, लाइक एक बार स्मोक किया डोपामाइन रिलीज हुआ, दूसरी बार स्मोक किया डोपामाइन रिलीज हुआ, कितने टाइम तक? The frequency increase, the magnitude of dopamine increase. एक बार अगर एक बार से अगर इतने अमाउंट से डोपामाइन रिलीज हो रहा है तो दूसरी बार ज्यादा अमाउंट चाहिए. This procedure takes time, it takes years, but it can lead to addiction. This is the all mechanism of addiction. You start with one smoke for a 1 hour. एक बार ट्राई करने में क्या जा रहा है, टेंशन चला जाएगा. कोई अच्छे दोस्त ने आके बताया है, हाँ सच में टेंशन चला गया, बट ये टेंशन टेम्पररी है. एज अ स्टूडेंट, एज अ ह्यूमन बीइंग, वी हैव सर्टेन रिस्पांसिबिलिटी. काम से भागने से कुछ नहीं होने वाला है. वी नीड टू वर्क फॉर इट. ये एडिक्शन टेम्पररी है, वी नीड टू फाइट अगेंस्ट इट. So how to confirm this is addiction? This slide is for doctors, so I'm like telling you as a doctor how to confirm a patient or as a person is addicted to from a tobacco or nicotine dependence. The first criteria is compulsive use. He use it frequently. सुबह पहले उठने से आधे घंटे में उनको स्मोक चाहिए. अगर वो ना हो तो खाने के बाद स्मोक चाहिए. हर 1 घंटे हर 2 घंटे में चाहिए. शायद उनका एक अलार्म सेट हो जाए, बायोलॉजिकल क्लॉक सेट हो गई है कि आई नीड अ स्मोक इन रिपीटेड पीरियड ऑफ टाइम. The psychoactive effect. Whenever I don't get smoke, I feel stress free. I feel confused. There is no euphoria in me. I feel I'm not that patient person. My anxiety level is increased. This is the psychoactive element acting on the body. These are called psychoactive effect. Drug reinforced behavior. Whenever I smoke nicotine or whenever I smoke tobacco, I feel good. I feel calm. So this is drug enforced behavior. Finally, as a doctor, we have something criteria. That criteria are in inventory form or there are some biomarkers. The inventory are mostly all of you have taken TCC class or in oral medicine and public health dentistry. We have something called tobacco cessation. In tobacco cessation, we have one inventory. We called it Fagerstrom inventory. That Fagerstrom inventory has 6 questions, and that 6 question has 3.3.3 point, total around 18 point or about 10 point, and you categorize according to the points. 7 to 8 high risk, less than 7 low risk, and moderate risk. Other than that, whenever you smoke nicotine, body liberates something called coitin. Whenever you find coitin in a blood marker, urine marker, or sweat marker, you will confirm that the person is addicted toward nicotine and the nicotine level is very high in that person. The next is tobacco cessation. Is it possible? The first thing I'll say, is it possible? This is my answer is yes, it is possible. A study says out of 28%, I already told gets tobacco, global tobacco survey says 28% people smoke, but out of them 50 to 55% says we need to stop this tobacco, but we don't have idea how to stop. In this 50 to 55%, I will say with their will or with their willingness, only 3% of population can leave tobacco. Means it is not 1 in 10%, I will tell, 0.3 in 10%. With the help of doctor or healthcare worker, only 8% of individual are chances that they can leave the tobacco. But WHO says when you are learned properly and if you diagnose properly and you counsel him properly, the chances are 30% higher. Means out of that 55%, which I consider as 100%, 30 people you can leave, you can increase their motivation to leave the tobacco. But as a doctor, I will say, ये 100 में से एक भी बंदा अगर tobacco smoke छोड़ रहा है, so that is very good. So first principle of tobacco cessation or first guideline, I would like to say cold turkey. Have you heard of cold turkey? The cold turkey means wherever, whichever situation I am, I will leave it for now. Like मैं आज tobacco smoking छोड़ना चाहता हूँ, I want to leave tobacco smoking, I will leave it now only, without considering withdrawal factor, without considering the consequence which tobacco cessation can lead to. So tobacco cessation can start with cold turkey. Whenever you have patient and he has tried cold turkey, or you ask them stop the tobacco, that is called cold turkey. But other than that, we have some mechanism which need dentist role. The cold turkey is just a suggestion from dentist, or patient can try himself also. But dentist has a major role in tobacco cessation. Why? Because that whenever a patient comes to you for oral examination, we are the first one to identify tobacco stain, tobacco lesions, pre-malignant and condition and lesion. So we are the first to encounter this problem. So whenever there is a tobacco patient, it is our duty as a healthcare professional to reach that patient or to make this patient to cease his tobacco habit. So how to start? You all have studied. Whenever a patient comes, the first is screen for oral cancer. Now, new guideline called golden rule or golden direction. Whenever patient comes to you and you think it is a tobacco related patient or tobacco smokers or tobacco user patient, examine it. The examination part, mostly oral medicine and public health dentist and other department are teaching you. So I'm not going in detail, but these are the part vestibules, phenoms, below the floor of mouth, buccal mucosa, we should check. After checking, just assume that what is the status of psychological, behavioral, and physical of nicotine dependency. Means patient is psychologically ready. His behavior, how you feel his behavior toward this quitting habit, and physical symptom. Is he able to like withstand the withdrawal symptom of tobacco? Just figure it out in an indirect or direct method, because our tobacco cessation based on these three criteria, because the withdrawal symptom affect physically also, psychologically also, and these two combine and change their behavior model, behavior thing also. So whenever you do a tobacco cessation, I would like to say assess these three indirectly for your knowledge or for your better prognosis of your case. Now, how to stop it? Tobacco cessation. The golden rules everybody has taught. The main question for your final years, or everybody should know this 5A and 5R. So how to start with the 5A? Ask. Whenever patient comes, it is the basic. You ask him, do you smoke? If he says no, just encourage him. You should not smoke. You should tell your family member and friend not to smoke. This is very good habit to encourage other people to not to do the thing which are which harmful to their body. If he says yes, then advise him. You should quit topic. This point, just remember, while advising, there are two type of patient. One will say, yes, sir, I want to quit tobacco smoking or tobacco habit. He is your patient. Start with other detail. But whenever patient says, sir, no, I don't want to smoke, he is not your patient. That time you should advise him the risk of tobacco and leave him. Don't force him. You should leave. You should leave. No, no. Patient should not get discouraged or demotivated to come to you. Just in a normal word, because if I tell you indirectly, we have clinic, we have some other treatment, because mostly tobacco cessation patient comes indirectly or some for other treatment, and then we suggest him for tobacco cessation. So finish your treatment, but just motivate him. You should leave it. Explain him the risk of or consequence of tobacco use. If patient agrees, then assess which stage he is, behavioral stage. Now, what are the behavioral stage? We will see in the next slide. If he is ready, I want to smoke, just advise him how to smoke it. You should do a cold turkey. You should use a 7D method. What is 7D method? I will be dealing with in next slide. Then assist him कि okay 2 week बाद आइए 4 week बाद आ दे. अगर वो like he is not able to leave that, then focus on NRT, focus on pharmacotherapy, because behavioral counseling not always gives you best result, because even a tobacco smoker has fight with himself only. बोला ना मेरी लड़ाई मेरे खुद से है, मैं tobacco नहीं छोड़ सकता. So that time you need to focus on NRT. That time you can assist him with a pharmacotherapy and NRT. And finally, arrange an environment, arrange a NRT, arrange a pharmacotherapy, or arrange an atmosphere that he can leave the tobacco. अब नाउ अगर वापस थर्ड स्टेज पे आते हैं जहां पे पेशेंट ने हमें ना बोला है कि नो आई डोंट वांट टू स्मोक, सॉरी आई डोंट वांट टू लीव, बट I'm trying to leave, but it is not that good. I'm not good with it. So that time you should go for this 5R, which is relevance. After quitting, what will happen to you? Why it is important to you? Just explain them risk. What are the negative consequences of your habit? Lastly, you tell him what are the reward. When you leave a smoke, your family will be good to you. You will get your financial security. Other than that, the social disability which everyone has, it will be at a higher level. Other than that, you can tell them this habit may lead to a cancer or systematic disease that you are absolutely secure if you leave it. Other than that, sometimes what happens, there are roadblocks. The roadblocks means patient will tell you कि मैं छोड़ना चाहता हूँ लेकिन नहीं हो पा रहा है मेरे से. तो identify that roadblock. Mostly the roadblocks are withdrawal symptom. Now there are multiple withdrawal symptoms. You have to identify each withdrawal symptom and to treat them individually. The best mechanism is to counsel them, identify the withdrawal symptom, and repeat this procedure whenever he comes to you. Yes, some people has asked me, sir, tobacco cessation में clinic में तो कहाँ करूँगा, मेरे पास इतना time भी नहीं है, and tobacco cessation patient don't give me that money. But I have seen a public health dentist and a oral medicine dentist putting their board that tobacco cessation is possible in my clinic. So it is advertising type of thing, and you can work on clinic and you can charge your patient for this, because first trial is your treatment trial. So that time आप charge नहीं कर सकते, लेकिन जब second visit में आता है तो at least you can charge him visiting charge. When he start trusting you, you can charge per visit for your tobacco cessation. Many of the study I have seen case report which are published as a tobacco cessation. So I have told you okay, this like third stage, assess. Assess means what? I was telling his behavior. The behavior based on this model, it is known as trans-theoretical model. I'm going in like brief about it because it is not that much useful for you. देखो एक एग्जांपल दे रहा हूँ, जस्ट फोकस ऑन इट. अभी आईपीएल चालू हुआ था, तो आईपीएल में क्या हुआ था, आई वाज टेलिंग माय पायर फ्रेंड कि भाई आईपीएल देख, मजा आ रहा है. तो वो बोल रहा है कि आई एम ना भाई, मैं आईपीएल नहीं देखता, मुझे मजा नहीं आता है. तो दिस स्टेज मैं आईपीएल देखता नहीं हूँ, मुझे मजा नहीं आता है. दिस इज कॉल्ड प्री कंटम्पलेशन, नो डिनायल. ओके, मुझे नहीं देखना है, मुझे नहीं करना है. ओके, फिर मैं रोज आईपीएल देख रहा हूँ, वैभव सूर्यवंशी इज प्लेइंग वेरी वेल, यार मजा आ रहा है आईपीएल देखने का, बहुत बिग स्कोरिंग मैच है. तो मेरे फ्रेंड को इंटरेस्ट आ रहा है और ही इज इंटरेस्टेड टू नो व्हाट इज आईपीएल, ही इज ईगर नाउ. दैट इज कॉल्ड कंटम्पलेशन. ओके, नाउ आफ्टर 5 मैच और 10 मैच ही इज टेलिंग मी, भाई आईपीएल अच्छा लगता है मुझे, मैं भी देखूंगा तुम्हारे साथ. So that is called preparation or determination. He thought he can watch this IPL and it is interesting. After 5th match, he started watching IPL. He already, भाई आज वैभव सूर्यवंशी बहुत अच्छा खेला है. The bowling pitch are not there, only batting pitch है और अच्छी है. और इसने full season देखा, full season match देखा और उसे अच्छा भी लग रहा है. अगले साल वो वापस देखेगा क्योंकि उसे IPL पसंद आने लग गए. ये एक अपने बिहेवियर का मॉडल है. दिस इज कॉल्ड ट्रांस थियोरेटिकल मॉडल. इट वाज गिवन बाय प्रोचास्का एंड डी क्लेमेंटे. ये मैकेनिज्म आपके दिमाग में क्लियर हो गई. लेकिन ये मेंटेनेंस फेज है ना, वहां से कोई भी रिटर्न आ सकता है. लाइक यार आईपीएल में मजा नहीं आ रहा है, बहुत ज्यादा रन हो रहे हैं, बॉलर के लिए कुछ भी नहीं है, ये सब तो पैसा भी मिला है. तो ये मेंटेनेंस फेज में ही कैन लीव इट और ही कैन स्टार्ट इट अगेन. ओके, आप ये मॉडल समझ गए हो, तो मैं इसे यहाँ पे पिक्चराइज करना चाहूंगा. अ पेशेंट केम टू मी in a pre-contemplation phase, कि sir I don't want to leave this cigarette, मैं जहां पे भी हूँ सही हूँ. I started explaining him 5A 5R and he thought कि यार ये easy लग रहा है थोड़ा, let's start. That is called contemplation. Now preparation, he told me sir अब से मैं एक सिगरेट तो छोड़ दूंगा और मैं प्लान कर रहा हूँ अगले मंडे से सिगरेट छोड़. That is preparation. Action, he started leaving 1 cigarette. कभी भी सिगरेट स्मोक बंद करा हो तो सभी सिगरेट साथ में नहीं करना है, 1-1 करके करना है. 1 सिगरेट, दैट इज कॉल्ड एक्शन. नाउ मेंटेनेंस. मेंटेनेंस में क्या होता है, या तो उसे विथड्रॉल सिम्टम इतने ज्यादा आ रहे हैं कि वो वापस स्टार्ट कर सकता है, या तो वो कंटिन्यू करेगा. दिस इज साइकिल. अगेन ही कैन कम इन प्री कंटम्पलेशन, अगेन कंटम्पलेशन. दिस इज साइकिल which is called trans theoretical model, and based on this cycle we are counseling his behavior of 5A 5R और फिर हम प्लान करेंगे कि उसे कैसे करें. सो ये इतना इजी है? इज दैट इजी? नहीं, इतना इजी नहीं है. क्यों? बिकॉज देयर आर विड्रॉल सिम्टम. सभी छोड़ना चाहते हैं सिगरेट, बट देयर आर विड्रॉल सिम्टम. द विड्रॉल सिम्टम यूजुअली क्या होता है कि निकोटीन की इफेक्ट जाने में टाइम लगता है. द निकोटीन की इफेक्ट टेम्पररी है, बट द विड्रॉल सिम्टम टेक्स टाइम. मुझे लग रहा है द टाइम लाइन एक बनाई गई है, दैट इज लाइक विड्रॉल सिम्टम की. दिस आर द विड्रॉल सिम्टम: रेस्टलेसनेस, हेडेक, डिफिकल्टी, कॉन्स्टिपेशन, डिप्रेशन, फैटिग, इंक्रीज इन हेपेटाइटिस, हार्ट रेट इंक्रीज होना, स्ट्रेस फील होना, क्रेविंग होना. लेकिन ये हम छोड़ सकते हैं. इसके लिए एक रूल है, दैट इज दैट रूल कॉल्ड 3-3-3 रूल और आईकी 3. अब यहाँ पे क्या करना है, द स्मोकिंग सिचुएशन का एक मेंटल रोड मैप. वी नीड टू पिक्चराइज अ मेंटल रोड मैप फॉर आवर सेल्फ एंड फॉर पेशेंट ऑल्सो, and inform briefly how the roadmap is. The roadmap contain physical, emotional, and psychological status based on its timeline. So it start with 3 days. पहली बार क्या होगा, निकोटिन डिटॉक्स होगा। डिटॉक्स कैसे होगा? निकोटिन फ्लशेस आउट टू यूरिन एंड स्वेटिंग में सबसे ज्यादा। दैट्स व्हाई वी एडवाइज आवर पेशेंट टू गो फॉर एक्सरसाइज, गो फॉर स्विमिंग, गो फॉर प्लेइंग, सो निकोटिन जल्दी जाएगा। देन थर्ड इज 3 वीक। यहाँ पे आपने वो रूल पढ़ा होगा, एक बुक में था, 21 डेज में हैबिट ब्रेक होती है या हैबिट बनती है। दिस 3 वीक रूल, 3 वीक्स में वो हैबिट स्टार्ट डिमिनिशिंग, देन 3 मंथ, कोई भी चीज 3 मंथ तक ट्राई करें, definitely it will become your lifestyle. So this 3 rule you should follow, and these 3 rule, और ये 3 rule में आपको जो withdrawal symptom आ रहे हैं, how to deal with that withdrawal symptom. So follow this 7D. It was 4D before, but there is a foundation called I Care Foundation, and they have given this called 7 Ds. Now first, जब भी आपको craving हो रही है, tell patient to drink water, because hydration निकोटिन को फ्लश आउट करने में हेल्प करता है। जितनी बार भी आपको हो रहा है 8 to 10 ग्लास पर डे इज बेटर फॉर अ पेशेंट। डीप ब्रीथ, अब ये डीप ब्रीथ डिले, ये है ना डिस्ट्रैक्शन एक्सरसाइज है। थे लाइक वी आर टेलिंग आवर पेशेंट टू डिस्ट्रैक्ट हिमसेल्फ फ्रॉम दिस हैबिट। डीप ब्रीथ, इनहेल मोर, स्टार्ट योगा और समथिंग लाइक, अगर जब भी किक स्टार्ट हो रहा है तो क्या करो, डिले करो, 1 घंटे बाद पीता हूँ, नहीं ये टास्क कंप्लीट करने के बाद पीता हूँ, एक काम करता हूँ, अभी वाला नहीं पीता हूँ, दूसरे वाला पीऊंगा, दैट इज कॉल्ड डिले। डिले करो, फिर डिस्ट्रैक्ट करो। डिस्ट्रैक्ट कैसे होगा? पढ़ो, म्यूजिक सुनो, स्टार्ट एक्सरसाइजिंग, स्टार्ट स्विमिंग, और सम फोकस ऑन सम अदर एक्टिविटी। और मोस्ट ऑफ द टाइम मैं बोल रहा हूँ कि बिलीव इन गॉड। जब लगे कि ये कुछ काम नहीं कर रहा है, जस्ट टॉक विद गॉड। ओके, सबको हैबिट होती है किसी के साथ बात करने की, टॉक विद गॉड। Lastly, diet, antioxidant rich diet, vitamins, protein rich diet help in de-addiction of any habit. Other than that, discuss. सबसे बड़ा सपोर्ट है फैमिली, फ्रेंड्स, एंड इफ दे आर नॉट विलिंग टू लिसन, क्योंकि बहुत बार ये होता है कि फ्रेंड ही अपने स्मोक करते हैं, वो मान नहीं रहे, और फैमिली को हम बता नहीं सकते बिकॉज वी आर इनसिक्योर, गाली देंगे पापा, मम्मी बोलेगी, तो दैट टाइम यू, योर मेंटर, और कभी कभार हमें लगता है मैं खुद से बात करता हूँ, और कभी कभार लगता है भगवान से बात करता हूँ, तो जस्ट टॉक विथ हिम। एंड फाइनली, अगर ये कुछ भी चीज पॉसिबल नहीं है, try with your doctor, take a drug, or as a doctor you suggest them drug. The drug, as a tobacco cessation, as a dentist, you can perform NRT. If you want to go for a pharmacotherapy, suggest him a good psychiatric treatment or psychologist. Now let's come on NRT, the main part. We just brush through with this part. तो NRT stand for nicotine replacement therapy. अब क्या हुआ था, ये एक्सपोजिंग वाला सीन यहाँ से स्टार्ट होता है। Tobacco started, और maniac of tobacco is leading cancer, tobacco is leading systematic disease. तो अब tobacco के जो कंज्यूमर थे वो कम होने लगे थे। Mostly before 5-10 years, tobacco consumers are literally new startup कम होने लगे थे। तो they started something based on medicament. They started e-cigarette, but before that there were something called as a medicament, which was nicotine gum, nicotine patch, nicotine spray, and some pharmacotherapy. So let's talk about nicotine gum. So I told you there is something called Fagerstrom index. वो आपको बताती है कि how much chance of addiction you have. तो वो addiction में आप क्या करते हो, nicotine gums को prescribe करते हो। जैसे कि अगर कोई person, if he smoke 20 cigarette per day, he is considered as higher dependence person. Or if someone smoke within the 30 minutes of waking up, so it is considered as a higher level of dependence in that patient. So that time we divide the dose of nicotine gum. The nicotine gums are available in 2 gram and 2 milligram and 4 milligram. What we do is we prescribe them, but we prescribe for certain period of time. It should not increase about 6 months. Okay. The other product, the nicotine gum has some guideline, like how to chew it, कहाँ पे throw करनी है, कैसे use करना है. The guideline I am not dealing in this class because अपने पास discuss करने के लिए और एक बड़ा topic बाकी. Then a nicotine patch, वो आपको 21 ग्राम, 14 ग्राम और 6 ग्राम के पैकेट में आता है। मोस्टली क्या करते हैं, हाथ पे रख लेते हैं या बकल म्यूकोसा पे रख लेते हैं, और वो टाइमली ड्यूरेशन में इट लिबरेट निकोटिन। The nicotine nasal spray, it is more potent than this two. वो spray आपको nose में spray करना होता है। It give you tangy sensation, but okay, people are using because it is more beneficial. But ये तीनों product, there are chance you get addicted to this, all the 3 product. The e-cigarette are the same product which was started and people got addicted for this e-cigarette. If this 3 treatment or NRT is not working, what to do? Then there is a drug called bupropion and varenicline. These are the first line of drug which we use for a tobacco cessation. The second line of drug are clonidine and something called diazepam agonist. So these are the patch, the pictures, gums and lozenge. Varenicline and bupropion वो कैसे start करना है? Please note that a dentist cannot prescribe varenicline and bupropion because they are psychoaddictive drug. वो diazepam based काम करते हैं. So mostly when you want to prescribe this, suggest them go to a psychologist or go to a TCC center of district health or go to a government hospital where a psychologist is present. He can prescribe because this drug need a count of prescription. So as a dentist, we cannot provide this, but NDC and TCC cell of India are planning that even a dentist should get an opportunity to prescribe this type of drug. So before starting any pharmacotherapy, before 1 week, you should tell a patient कि भाई आपको अभी से सिगरेट बंद करना है. मतलब अगर पेशेंट को आपको बोलना पड़ेगा कि आप 1 वीक बाद सिगरेट बंद करोगे तो उसके 1 वीक बाद आई विल स्टार्ट दिस मेडिकेशन. अब ये मेडिकेशन कैसे देना है? फर्स्ट 7 वीक तक 3 टाइम्स अ डे, 1 टाइम अ डे से स्टार्ट करना है, फिर 2 टाइम्स अ डे एंड देन ग्रेजुअली डिक्रीजिंग. ये मेडिकेशन विद इन 3 to 6 मंथ आपको बंद करवाना है, पेशेंट को अपने नॉर्मल इसमें लाना है. मोस्टली फार्माकोथेरेपी आर सक्सेसफुल, देयर सक्सेस रेट इज अराउंड 40 to 42%. Other than that, there are rehabilitation centers which provide you restraint not to use this type of tobacco or tobacco product or any substitute. So let's summarize the algorithm of TCC. The first step was asked, do you smoke or do you don't smoke? If he says, yes, I smoke, then advise him. If he is willing to stop, then identify which stage he is, pre-contemplation or contemplation, and then plan, okay, what I will do. First, identify his dependency based on Fagerstrom scale or based on the other nicotine or other dependent scale. If you found it nicotine dependent, then consider him as a NRT, provide a star therapy. If you think he is a social and psychological dependent, then we need to go for a pharmacovigilance. So after you smoke, quit tobacco smoking, what happens? Actually, these are only physiological sign. The physical sign, I will tell, these are more dangerous. The physical sign looks good, but the withdrawal symptoms are bad. That's why people leave it. But if you want to motivate patient, just show him this sign. Within the 20 minutes, their oxygen level, pulse rate and blood pressure comes to normal. Within 8 hours, their oxygen level returns to normal. Their carbon monoxide level gets down in a 24 hours. The nicotine which you started, which was absorbed in body, now it start get eliminated through urine or through sweating. Other than that, your bronchial tubes or your cilia start functioning more efficiently, which was before. Your circulation improves within 2 to 12 months, but the major recovery means your risk of lung cancer or decrease in oral cancer chance comes after 10 to 15 years. It is very long procedure, but we don't have an option, or other than that, at least a healthy life कभी भी मिलनी healthy ही गिनी जाएगी. Start helping your patient to quit tobacco. Explain them this chart. Withdrawal symptoms are just temporary. It will go within 3 months. Explain them and then start. It will give you better effect. So this is for patient that you can explain. It will improve your work-life balance. It will provide you social impact, like your social desirability. जब कोई बात ही नहीं करता था मेरे साथ, मैं smoke करता था. Now my family started accepting me. Your behavioral and psychological status change. कभी बार पता है सिगरेट पीने से, सिगरेट ना मिलने से स्ट्रेस आता है, तो वो अब जाना दूर जल्दी स्टार्ट हो जाएगा. Environmental impact. As we show, third hand smoking, fourth hand smoking, environmental sickness, that will go up. And finally, the major update, financial impact. ऐसे बोला जाता है ये टोबैको इंडस्ट्री एक इंडिविजुअल को अराउंड 220 लाख तक लाइफ टाइम में पैसे खर्च करवाती है. That 20 lakhs can be saved if you smoke anytime, if you leave smoking anytime. So this was our brushing through our मैनेजमेंट, हाउ वी डील. कोल्ड टर्की बुक और वेबसाइट पढ़ो, स्पेशलिस्ट से बात करो क्विट लाइन पे, फेस टू फेस बात करो अगर नहीं हो पा रहा है. एड टू वेबसाइट क्विट टेक्स्ट जो होता है, मैसेज आते हैं, एम सजेशन जो बोलते हैं वो स्टार्ट करो. इफ नहीं पॉसिबल है, एनआरटी दैट इज पैचेस, ओरल एनआरटी. लास्टली फार्माकोविजिलेंस, और अगर नहीं हो रहा है तो क्विट स्पेशलिस्ट, पैचेस और सबका कॉम्बिनेशन स्टार्ट करो तो सक्सेस मिलनी ही. I would like to say here कि बहुत बार क्या होता है, we don't have nearby dental college, nearby TCC center, so you can provide at MCS and tobacco lines which are available in every state, every district. For Amargarh, I would say we have something called Institute Helpline for TCC, Oral Medicine Department or Public Health and Dentistry Department. And definitely there will be a landline number or a mobile number which can help patient for mobile cessation or tobacco and cessation. Because most of the time what happened, the tobacco smoker are very busy person or they don't like to talk face to face. So that time this guideline, they want to hide their identity. So that time this helpline can help us to achieve tobacco cessation. So सब कुछ डेंटिस्ट कर रहा है, गवर्नमेंट कुछ कर रही है या नहीं इसके लिए? गवर्नमेंट हैज ट्राइड लॉट, बट द टोबैको माफियाज एंड टोबैको इंडस्ट्री कुछ ना कुछ every time they find out some loophole where they can act. मतलब the loophole they manage it that nicely. They doesn't come under any regulatory mechanism or administrative mechanism, and they perform their business very well. For legal approach, I would say 2003-2004 में जब ये tobacco menace was increasing like outburst हो रहा था, that time tobacco के लिए एक framework हुआ that is known as WHO Framework Convention on Tobacco Control, that is also known FCTC. So they provided one guideline for each country. Around 186 country has took part in this. India was 6th country to sign this WHO FCTC. According to this guideline, they have provided some specific regulation that you any country should do to achieve a tobacco related legalization. So that the word they give, empower. The empower stand for monitoring tobacco use, protecting the people from tobacco, offering them help, warning them about tobacco use, and enforce the ban on tobacco advertisement and raise tax on tobacco. If you see properly, India has taken this all the 6 guidelines. They have monitored tobacco use. They have policy to identify to counter tobacco cessation. They are protecting people, but people are only listening, not listening to government. They are offering guideline. हमने देखा वो hotline है, helpline है जो help करने के लिए. There are pictorial graphics on tobacco that warns you about the tobacco lead to a cancer. There are enforcing ban like legalization के 18 से छोटे बच्चे को we should not sell. They are rising tax. अभी का recent बोल रहा हूँ 2026 में government has raised tax on tobacco products. तो ये करने से actually the lobby से इसका एक फायदा भी है, एक नुकसान भी है. Benefit I would say कि people start thinking about their financial strategy, and what they do, they try to reduce their consumption of tobacco so that they won't purchase it overpriced tobacco. But other than that, what other people think कि price you decrease or increase, the people who wants to eat, they will eat. So it will provide financial burden to their family. So ये एक two-sided sword है. मतलब people are thinking the fiscal policy are bad or good. Let's see अभी तो apply किया है, क्या हो रहा है. If you see Indian policy, there is act called COTPA, which stand for Cigarette and Other Product Tobacco Act. So यहाँ पे ये COTPA में there are 4 main column, the 4 main act. It is start with section 4, section 5, section 6A, section 6B. अगर याद रख पाओ तो ठीक है, क्योंकि कोटपा मोस्टली मुझे लग रहा है डेंटल स्टूडेंट को कोई एग्जाम होती है जैसे जीपीएससी एंड ऑल एग्जाम, दे आस्क डू यू नो अबाउट कोटपा. तो कोटपा स्टार्टेड इन 2003. कोटपा में 4 रेगुलेशन, 4 सेक्शन है. सेक्शन ए स्टैंड फॉर डोंट स्मोक इन पब्लिक प्लेस, सबको पता है, लेकिन ये सेक्शन 4 में आता है. सेक्शन 5 पब्लिक प्लेस के अलावा डोंट एडवर्टाइज इट ऑन अ पब्लिक प्लेस, मूवी और ओटीटी. ये बाद में 2023 में भी ऐड हुआ है. कोटपा का एक रेगुलेशन चेंज हुआ है, ये वाला चेंज हुआ था. अदर देन दैट देयर इज कॉल्ड 6A व्हिच सेज don't sell any tobacco product to a minors. That is comes under 6A. And 6B suggests follow yellow line. Now the yellow line says you should not sell any tobacco product around educational institute or school or colleges. तो ये 6 गाइडलाइन थी. लेकिन टोबैको इंडस्ट्री ने क्या किया, ये गाइडलाइन को समझा और अपने प्रोडक्ट को ऐसे डिजाइन किया कि that should not comes under this regulation. They started using something called e-cigarette, newer sleek design of tobacco product. Tobacco they sell on the name of pan masala, so they can sell it on yellow line also. So government come with a newer purpose of something called PECA 2019. Now PECA, it is prohibition of electronic cigarette. In India, electronic cigarette are totally banned. If you found with any cigarette or this e-cigarette related product, you may get 50,000 of fine on first offense and 6 months of jail. अगर ये repeated है तो you can get 3 years of fine with up to 5 lakhs rupees of penalty to you according to this PEC Act. This CODPA has recently changed. They have provided one more guideline in 2026 that tax should be increased on tobacco product based on their consumption according to their state. Now means each state can ban tobacco, each state can hire their tobacco price, or each state has right. They can decide whether the tobacco pocket should be sell in their vicinity or not. Other than that, government has provided guideline that every institute or every office or every public place should have a guideline like this. Tobacco, this is tobacco free workplace. You should not smoke here. You should not use any tobacco product here. So this were about tobacco. Now start with WHO campaign. You see, we have provided all the rules. WHO is doing all the work, but every time, each year, the tobacco industry find out some new loophole. They start some new design. They reinvent some new engineering for tobacco. So WHO has decided we should focus year-wise to each tobacco. It doesn't mean that last साल का जो था उसे इस साल भूल जाओ. Continue करो, but each time focus should be on different vicinity. So this time WHO has searched people to identify the newer method what tobacco industry are using to just increasing their younger population customer or to increase their reach to a younger population. This campaign mostly started to increase the awareness. Awareness means I already told you they are using nicotine product as an e-cigarette. वहां पे वो लोग use कर रहे हैं nicotine salt, nicotine analog. So raise awareness. These are more harmful because I will told the lethal dose was 70 mg. In one packet now they are providing 150 mg of nicotine in one sachet of this e-cigarette. Now advocate for stronger policy. Flavored tobacco. Actually, I have seen a scenario I will tell. कि जैसे भी स्टार्ट होता है ना टोबैको कैसे स्टार्ट होता है एक दोस्त बोलता है कि यार ट्राई करके देख स्ट्रॉबेरी जैसा लग रहा है ट्राई करके देख बबल गम जैसा लग रहा है कुछ नहीं होता ट्राई कर सो ये स्वीट फ्लेवर की वजह से द टीनेजर्स द यंगर पीपल स्टार्ट इट्स स्मोक लाइक टोबैको देख पढ़ इस पे लिखा है कि इट इज कंटेंट ओनली 5% ऑफ टोबैको और नो निकोटीन दिस आर द फॉल्स एडवर्टाइजमेंट जस्ट टू create a false security that is you are risk free individual. So this type of action should be advocated. Stronger policy should be there to avoid this flavored, avoid this design, and avoid this false advertisement about tobacco. Now, to prevent addiction and reduce demand, there should be a capping to each company. Like we know ITC is regulating our tobacco industry. Now, there should be a cap. The cap word means I want to tell एक guideline होनी चाहिए that will say you should product this many tobacco product only per year or per time. This will prevent addiction and reduce demand. Other than that, state should have a responsibility. I am banning tobacco for 8 days, for 1 month, because this cycle will break. As the cycle will break, the addiction will start breaking itself only. So let's talk about this appeal, which was the second part of this seminar. Hope you are not bored. Please, Mandip sir, be a moderator for me. If I'm boring them, just let me know so I will finish fast. So let's start with unmasking the appeal, the tobacco industry exposed. So this appeal or this theme says unmasking the appeal, countering the nicotine and tobacco addiction. The 2026 World Nobel Tobacco theme was totally based on exposing the tobacco mafia. In Government Dental College, we have started this campaign in Gujarati. We says Tamaku Mafia no Pardafash. The newspaper says ये कहाँ पे लिखा है, लेकिन we ourselves introduce the word because our public should know कि ये क्या हो रहा है. Because मैंने देखा जब मैं when I was in Amargarh has highest media reach among any college I have seen because the media power of Amargarh Institute is very good. They publish their advertisement, they advocate about not to use tobacco, and we can also use, or as a student, you can also use your social media to say Tambaku Mafia no Parda fast. So this campaign focus on exposing the industry tactics that target youth with attractive marketing, flavored product, and the new nicotine delivery system. How they do it? So they have something called engineering teams of engineering team of marketing strategy, team of people who engineer this tobacco product, which can like set in the this generation or upcoming generation. So the WHO theme says, please unmask this appeal or unmask these people. So WHO says, okay, tobacco industry knows they kill million of people, 8 million, I'm saying roughly 8 million of people they are killing, but they say it, they are still inventing newer and newer method to increase their business model. They are using flavored cigarette, nicotine pouches, nicotine product. Okay, people will use it more because we are losing 8 lakh people. This cycle should continue. So they are telling that, okay, though we are killing their customer, but they need to build up their new customer. So that's why they are using this reinventing technique and business model. So a newer data says, this is recent data. It is not published anywhere, but WHO has given this time in 2026. 40 million adolescents, roughly around 13 to 15, which we call as teenager, use tobacco in any form. That can be one time, two time, or कैसे भी use तो करते हैं. Among them, 15 million adolescents worldwide already use e-cigarette because it looks cool. मैंने ऐसे सुना है, मैंने सीरीज भी देखी है दो तीन. They say it looks cool, it is poured or more poured. In a country with available data, the adolescents are on average 9 times more likely to vape than adults. Now, क्यों vape कर रहे हैं तो बुरा क्या है? Nicotine only addiction बढ़ा रहा है, दूसरा तो कुछ नहीं कर रहा है. No, nicotine has a carbon monoxide. That air you inhale in nicotine smoke is carbon monoxide. Other than that, there is something called get away effect. Get away effect. Matlab, they started nicotine as a play or nicotine poured as a nicotine play to reduce their stress or roughly anxiety. But their nicotine poured can lead them to start a new tobacco product, which is tobacco pouch. And it is already started. Tobacco pouch, cigarette, or other harmful tobacco product, they can easily start this scenario called getaway effect, and I think they are 9 times more prone for this getaway effect. So tobacco trap, it's hooked by lie. I will like to say the brief history of tobacco. The tobacco start kaise hua? Native Americans which were using tobacco as a numbing action or just to give a gesture of they are hosting someone to English people or Portuguese people. So they gave them it will increase your calmness. It is like reduce your anxiety. And Portuguese people, they started smoking it. It was started in tobacco, the place, and that's why it is known as tobacco. So the Portuguese people liked it, and they told that European industry can grow very nicely here. So what they did, they transferred it to European industry. Now the Portuguese can they show this tobacco as a royalty. ये एक अलग झूठ था कि हाँ ये royal लोग ही पीते हैं. Only Englishmen speak or only Portuguese can smoke cigarette and tobacco, and they have delivered it to Mughals and the Rajas and kings of that time. The Rajas and kings, due to royalty, they start smoking. Seeing Raja and Praja, even Prajas thought ये तो royalty की निशानी है, I should start smoking. The market started growing in India, Asia, Asian country, and China. So what they did with the Gujarat area, Bihar area, Andhra Pradesh area, they thought the soil is very favorable for cultivating tobacco, and they start cultivating tobacco, giving false hope that tobacco industry is taking your tobacco product or tobacco leaves in a greater price than normal whatever they are earning. So this was another lie. Lastly, now the tobacco in 90s, they start when you have stress, when you look like a macho man, when you want to live a glamorous life, smoke tobacco. So this was all tobacco lies, but now the strategy has changed. Now they have focused on marketing tactics. They are telling, okay, we should attract youth. The generation has changed. So now how to attract youth? Just they give them false information about the report. Like it is designed to normalize nicotine use, lower the perception of risk. By nicotine doesn't lead to a cancer. They are only marketing कि nicotine cancer नहीं करवाता है. You can smoke e-cigarette. Other than that, they are giving a handy devices which can be taken anywhere without security check. It looks fine. It can be used as a keychain. It can be used as a pen, and it can be used as a newer a newer way to look cool. So this is the marketing strategy what tobacco trap is using by a lies. So let's see beneath the all there is a smoke which can lead to oral cancer. The tobacco industry tactics and deception. The tobacco industry, they have very aggressive promotion and they promote their product through this new appealing look, newer look, sleek look. The tobacco product के pouch भी देखो, the shiny pouch with वहाँ पे hero के photo या फिर वहाँ पे the flavored tobacco और it looks cool. जो डब्बा भी आता है वो लग रहा है कि हाँ we can store something in that डब्बा. Other than that, newer taste, newer flavor. Kesar ka swad, they have started with tulsi, menthol for medicament purposes. Other than that, they are advertising it is safer. Nicotine, e-cigarette are safer. They are less harmful. Other than based on the innovation, they have started new methods of consuming tobacco. जैसे chocolate के साथ tobacco खाओ, lip gloss के साथ tobacco, nicotine based beauty product. That is the innovation they are doing. The newer chemical composition. Actually, nicotine, no, it delivers roughly 8 to a cigarette. It roughly delivers 8 to 12 gram of nicotine per cigarette. But now what they have done to increase the craving, increase the utilization of nicotine, what they do, they add up to 70 milligram to 150 milligram of nicotine salt directly to the device. So your craving increase, your addiction chance increases with that products. So first, I would like to talk about product design. This is a picture given by FCTC, WHO. This is brighter the product, darker the intention. जितना bright product होगा, dark उतना intention हो गया. Tobacco industry क्या करे? They manipulate tobacco design, attractive, एकदम glamorized pouches, which gives you like false security or evoke desirability कि yeah, I should try once. क्या है देखता तो हूँ. New type of hookah design, new type of e-cigarette design, new type of pouches, new type of cigarette design which are sleek. I have seen cigarette with switch. When you switch it, they turn into menthol flavor to some different flavor. I don't know the flavor, but different flavor. These are the product design they are marketing. Other than that, the sleek design, harmless packaging, USB drive से भी charge हो जाएगा. It contains battery. It is refilled. You can use it multiple times. The colors to attract women customers. And it reports widespread in the industry that younger individual buy कर रहे हैं इसे. Other than that, this picture I have already shown. You can see they have targeted each age wise. बड़ों के लिए अलग, youth के लिए अलग, according to your occupation अलग. For business purpose, pen type of design. Student के लिए pen type of design. अगर बच्चे हो तो cord के type design, which contain play toys and play like a device. So these are unmasking. These are masking tobacco industry because it looks cool. Now flavors. This is the main, I think, tactics followed by the tobacco industry. What they did before, the tobacco was only used for smoke, but later on they decided if we add flavor in tobacco, यहाँ पे हम we can reach to a maximum people, or we can fool people by telling that it is a strawberry flavored nicotine, not a tobacco product. It is less harmful. So the tobacco flavor started in 95 around. They started in RJ industry, the renowned company, same, he started fun and trendy flavors. They started with bubblegum, fruit flavor, and the other flavor. Now this flavor, they masked tobacco smell. Some people don't like tobacco smell. They masked this tobacco smell and they started, this is a way of healthy showing the fruity smell. They have ingredient of fruit. But other than that, one more thing is happening here. When you children and younger individual, they get gratification or satisfaction from food. अगर आपको कुछ चीज अच्छी लग रही है, खाना अच्छा लग रहा है, तो आप उसे बार बार खाओगे. The same, the strawberry flavor or the fruity flavor, it is increasing their frequency to smoke that vape again and again, which is leading to addiction again and again. Other than that, now the pouches, we were talking about this only smoke tobacco. If we see in Indian scenario, the Indian industry has started a kesar flavor, elaichi flavor, and menthol flavor, paper flavor, or sometimes they say it is with medicament, ginger and tulsi, it will cure your throat, sore throat. So these are the tactics which are using under the cover of flavors. Is there any rule that can ban flavor? I would like to say, if we ban a flavor use, there can be a chance we can reduce the uptake of tobacco product each time. Flavor accessory row was a challenge because there are no regulation. A flavor is like they use a chemical flavor that can lead to like the acetone or aspartame or acid जो sweetener है वो use करते हैं, but there is no study which can say that these are harmful to a body. So they are using it freely. They found out this loophole के fruity flavor, bubblegum flavor or kesar elaichi has no harm in body. So they are using as a nicotine will reduce your smoking addiction and plus the smell will like you. So other than stopping that smoking or tobacco cessation, we are getting addicted to this nicotine product which are based on some other theory. The tobacco industry manipulate the perception of risk. It started before. Pehle they started having BD. BD tha, they started BD directly inhalation of smoke from BD is without filter can lead to a lung cancer very early. So what they have marketed, it is filtered and it is less fatal. The first company says all tobacco filter, it smoothens the tobacco naturally or it will provide less harshness. Means tobacco, अगर आपने देखा होगा first time if you smoke tobacco, it feels hard. Now they say it is filtered. The filter one passes that smoke to the filter and it will give you less harm or it is very less harmful. So this is one more lie posed by this tobacco industry. Then the social media and influencer ad. India में बोल रहे हैं जैसे कि सिनेमा है तब तक सब कुछ चलेगा. The social media has maximum reach. The social media has reached each home, each house, each mobile, and tobacco industry knows that very well. And what they have started, the influencer, micro celebrity, they provide some money and just use any of our product in your reels. When you see some influencer using tobacco like that e-cigarette or nicotine device in their platform or OTT platform or social media, you think it's look cool. Let me start. So this is one of the best marketing done by tobacco industry to reach to a maximum population. Other than that, a country like India, where the older population also have this tobacco smoke, they are campaigning it with the freedom, glamour, rebellious lifestyle. Now what they did, they actually start assigning a hero. Like मैं बोल रहा हूँ like शाहरुख खान, the king of Bollywood हम बोलते हैं. Akshay Kumar and Ajay Devgan, they are giving this advertise, Bolo Juba Kesri. And the benefit of this marketing, Vimal is estimated at around 1600 crore and become one of the category's most visible brand through a celebrity driven marketing. ये reach उन लोगों की social media के through हो चुकी है. Other than that, sponsorship, the sponsorship is not possible in India because India bans tobacco. But if you see advertisement, the first advertisement I remember, cricket or Formula One, mein, you definitely see this type of video. Virendra Sehwag, Kapil Dev, the world champion, they are smoking and eating Vimal. Other than that, this is Firozshah Kotla Stadium of Delhi. Everywhere I see Pan Bahar and Vimal advertise. This is the advertisement status, and they advertise is like a pan masala, means false advertisement. This advertisement, other than that, they have included this advertisement in our culture also. Like previous advertise, we have seen Pan Parak. बारातियों का स्वागत सिर्फ पान पराग से करें. Means we had one custom that while the dulha comes to our home, we provide him supari and pan. But they have changed our culture ke pan parag se start karo. So this become advertisement strategy for this type of people or tobacco industry. Other than that, the sweet lies and better truth, I will tell it, they are marketing it as a beginner, advanced and expert stage, which is totally lie. Nicotine at 0 level, nicotine at 70 milligram, nicotine at 150 milligram can lead to addiction, that is zero. Flavored life, flavored hookah, and other free content 5% of tobacco, and which can directly lead to cannot directly lead to a cancer, but 5% tobacco or 100% tobacco both has same effect. So this is where their strategy targeting younger generation, new product, old product को new product दिखाएंगे, OTT platform, social media, and other than that, handcraft material. So these are the technique. I'm just showing you picture. So my slide is getting over. These are just picture. ये जो पहले से ads हो रही थी, glamorous दिखाना, golf tour दिखाना, vacation दिखाना. यहाँ पे देखो, it's a honeydew smooth. गले में harshness नहीं होगा. The next is discover the passion. These are the tagline which was given by some meme foundation. Feel the force. Formula One ads. Like the cigarette is for real smoker. Believe it. It is like Bahamas. Or made for each other. only to be unmade soon if you get a cancer. Lastly, Rajnigandha, bade log uchi pasand. Then inspired creation. The tagline is very nice, and how they have marketed it reached every population. Even today, also after 20 years of this advertised ban, we are remembering this advertisement. So other hidden tactics are chemical enhancement. I told you like nicotine salt and analog, which are more potent than a normal nicotine. They are including there in a e-cigarette. Other than that, harshness masking, use of honey, use of less tobacco product and more nicotine. Other than digital exploitation, which is done by Instagram, YouTube, other advertisement, and finally the technological glamour. The technological glamour for e-cigarette are like refilled, recharge, or it can be used as a lip gloss. It can be used as a stress relieving device. These are the technological glamour. But here I wanted to like this product. I have seen this product in our Saurashtra only. Technological glamour by local vendors, I would like to say. These are the device which crush mawa in a smaller particle. This device automatically mix or rub mawa, so you don't have to mix in a hand. These are the technology taken by the local vendor to increase their reach or increase their sale of tobacco product. And really, I'm telling people are convinced about using these tobacco products. So the illusion versus reality. Let's see the fun and trendy flavors, what they are leading severe addiction. This harshness is reduced, so people are more inclined to use it repeated way again and again. Slick and harmless design, deceptive marketing. अरे ये तो बहुत अच्छा है, किसी को पता नहीं चलेगा. Let me use. So people are free to use it. Other than that, social media and influencer ad, this can possess a long-term health risk because even it is like it is proven that e-cigarette can also lead to a lung cancer. So the e-cigarette doesn't cause lung cancer, but the heated product, the heated steam or heated air going inside a alveoli or lungs can easily lead to a lung cancer. So should we counter it, or how can we counter it? How can we expose them? We have already exposed them. Now you know these are the tactics. As a dental student, as a dental doctor, you know the what tobacco industry is doing. So what we can do as a policymaker or as a healthcare worker, what we can do? Ban flavors. We can advocate government. It is already started. Make flavor a thing of past. ये पास्ट में चल रहा था, अब नहीं चलेगा. विमल केसरिया जो केसर फ्लेवर, नो इट इज नॉट रिक्वायर्ड. Regulate product design. Pictures होना ही चाहिए that is showing cancer can be cancer can be happen due to this product. Plain packaging, कोई glamorous marketing नहीं, no colorful images. Ban advertisement, promotion, the mostly the OTT platform which were free to advertise anything. Tobacco and nicotine free public place, like public place से और बढ़ाओ. येलो लाइन जैसे स्टार्ट हुआ वैसे और लाइन स्टार्ट करो. देन कॉलेज कैंपस, इंस्टीट्यूटल कैंपस के अलावा भी बाकी सब है वहां पे बैन करवाओ. Support quitting. If your friend or your family member is adopting to leave tobacco, just help them. And finally, the fiscal measure, increase the tax, less affordable, make it less affordable, make it less accessible. Finally, this question arises to every student. Why can't we ban tobacco? Why can't we ban tobacco in India? ये बहुत question बहुत बार arise हुआ है, लेकिन there are some certain parameters that government should see. Like we cannot easily ban tobacco because the complex mix of economical dependency. अगर हम एग्रीकल्चर डिपार्टमेंट ही देखें तो टोबैको इंडस्ट्री बहुत ज्यादा डिपेंडेंट है एग्रीकल्चर डिपार्टमेंट. देयर आर फार्मर्स हु कल्टीवेट टोबैको. इफ एक साल की टोबैको अगर नहीं बिक रही है, इट इज वेरी हार्श फॉर देम. Other than that, whenever I will stop a tobacco, there is a backlash. Definitely public outrage will be there. Other than that, black market threat, the political pressure will arise. जो भी political party पहले tobacco ban करेगी, he knows there are chances I will reduce my vote bank. So this category I have categorized why tobacco remain legal. The first is massive tax revenue. The tobacco industry 18,000 crore की है. The ITC, Indian Tobacco Company, 18,000 crore की है. I don't think government will take this chance to ban this tobacco industry or reduce their GDP and GNP by banning this tobacco industry because it is leading a massive tax revenue for them. Other than that, black market trade. The best example I can tell you, in Corona, when the tobacco or the tobacco product were not available, what people used to do, they used to smuggle it. They used to give more price for it. So this is black market trade. And what happens? The financial constraint happens to family. The economic shock and unemployment. What will the tobacco industry employer will do? What the tobacco industry, the BD, BD is a small industry which is like very fastly grown industry in a small area or small town where they use handmade BD and they sell it. This is the one of the main reason, like population of Jharkhand and Chhattisgarh, where they sell it and this leave the livelihood. So they can give an economic shock to agriculture department also, even tax department also, and it can lead to unemployment also. Furthermore, mass addiction and public unrest. No company or no government or no political party want a public unrest. They know if we ban certain thing, there will be a chance that will be a public outrage and we will lose our vote bank. Finally, personal autonomy. India or the Constitution of India believes a personal right, a human right. A person has choice to eat whatever he likes, choice to stay whatever he do, and choice to do whatever he wants. So this becomes personal autonomy. Whenever I say a tobacco should be banned, the personal autonomy will say it depends on me whether I smoke it or not it. And the finally, corporate clothing, the ITC industry, again, I told the Reynolds, the Camel industry, there are 18,000 industry in only India, the British Tobacco Company and other 4-5 company, which are since 200 years, they have a very strong corporate lobbying. They advocate about newer product. They advocate about tobacco is not that harmful. Recently in a Somalia, in a meeting, the minister has to say tobacco lead to a cancer. I apologize that I have mistakenly told that the tobacco doesn't cause any disease. So these are the reason where tobacco remain illegal still in India. Again, that can we ban tobacco? Is it possible? Can we do a tobacco endgame strategy? Now, what is tobacco endgame strategy? We slowly do a tobacco ban, like we increase a tobacco tax, we increase a capping on tobacco device, we increase a certain amount of pressure on tobacco industry that they reduce their sell for the advertisement. So that is called tobacco end game. And this starts slowly. This start over regulation. Prohibition are at a smaller extent, but the regulation is needed for everything. Is there any example this strategy will work? So I will give you example. There are only 2 countries which has achieved total ban. One is Bhutan. Bhutan in 90s has tried. We will not use any tobacco product in our country, and they are achieving it. Bhutan has very less proximity to India, and what Indian population do? They migrate and they smuggle tobacco product to Bhutan. Again, Maldives. Maldives has achieved a strong tobacco prohibition and strong tobacco regulation board, and they are now tobacco-free country, only one in world that doesn't use any type of tobacco product. But if India has to do something, I would like to say India has to follow a New Zealand performa. What New Zealand had to in 2012, New Zealand has provided a regulation. They told we should stop a tobacco product sell from 2016. In 2012, they told 2016 से कोई भी tobacco product country में नहीं बिकेगा. The 4 years window period they gave to a population to leave their habit, to destroy their addiction, the tobacco industry or tobacco companies to vacate or to find other business, the unemployed person to find a newer job, that they had given a 4-year of window period. But it was not become possible. 2016 is already passed. Now they have passed a new resolution which says in 2026, we would stop any tobacco product. If India want to do it, India can do it, but 140 crore of population, it makes very hard for Indian government to find out and to regulate by these rules. So in conclusion, I will say smoking isn't a habit. It is carefully crafted strategy. And for now, I will say most of the people start smoking seeing others. The glamorizes of smoking through movies, social media, misleading ads, making it seem cool. And that type of picturization can enhance our younger generations reach towards smoke or smokeless tobacco. So I would like to say just motivate them what is going on in the tobacco industry, and by a doctor or as a healthcare professional, we can reach them very easily. So thank you, sir. These were my reference. For student, I would like to say my fourth reference and third reference, which are the reference menu for dental professional, which is available in Amargad also in the library or tobacco cessation department as an ebook also. We can you can just read very nicely given about tobacco, each effect of tobacco, tobacco legislation. The manual is good for reading if you are interested in this topic. Thank you, sir. Amargad, my second home. Thank you, Pankajakshi ma'am, Mandip sir, Mohsin sir, Pranav sir, and for coordinating nicely, Sharmi. Thank you, everyone. Thank you, sir, for giving me this opportunity. Sorry, I think, extended my time around, okay, 45 minutes I have extended.
Thank you, sir. Thank you. Thank you, sir, for sharing your valuable knowledge and insight with us. It was truly an informative and enlightening session. Now I invite Dr. Pranay Patel, sir, Head of Department from Department of Oral Medicine and Radiology to deliver the certificates and vote of thanks.
Yeah, once again, before we conclude, I would like to just take this opportunity to appreciate the efforts of Dr. Mayur Mishra. Dr. Mayur, is it? Hello?
Yes, ma'am. Yes, ma'am.
Am I audible?
Yes, ma'am. Yes,
Yeah,
ma'am.
Dr. Pranay, one second. Okay.
Yes.
I truly appreciate the efforts, Dr. Mayur. It was really crisp and clear, and you really did justice for the topic unmasking the appeal. And I
Ma'am, सब आपने ही सिखाया है,
really am
आपने,
thankful
मंदिर
that you
sir ने।
educated our students. No, but I really appreciate the efforts. Each and every slide was too educative, and your way of presentation was also too good. Thank you so much for
Thank you,
educating
ma'am.
our
Thank you, ma'am.
students. It was crisp and clear and did justice for unmasking the appeal theme. Thank you
Yeah, thank you, ma'am.
so
Thank
much.
you, ma'am.
Yeah, you please take over, Dr. Pranay. Sorry for interfering.
No problem. Is there any question for coordination?
If anybody wants to ask any question, the mic is open. Okay. So no questions. Thank you, Dr. Mayur, for the inspiring lecture on today's topic. One question I want to ask you in regards to the oral cancer treatment management under the government health policies. Should it be appropriate, or should the government should take some step to make it more valuable for the patient? Thank you, sir. I couldn't add this slide, sir, for treatment modality for oral cancer, actually. But, sir, I would like to talk about something called a golden line, which was started by government recently. So extremely sorry, you must be knowing about it. Sir, actually, it is for doctors, where a doctors directly can call a golden line and suggest okay, we have a patient which is suffering from oral carcinoma or some other type of carcinoma. So the treatment will be without appointment assigned to this individual. This golden line works in Ahmedabad, sir, the GACRI, our Cancer Institute. So as a doctor, sir, directly we can suggest them that we have one patient, he is suffering from oral carcinoma or squamous cell cancer, and he need immediate treatment. So without appointment, they directly take up this type of patient and provide this treatment under the category of Ayushman Bharat. So the treatment modality become free for a patient. Other than that, the most of the major treatment are available there. Other than that, for a Saurashtra region, they have started in Rajkot also. So focusing on our side or our region, the Rajkot has also good treatment facility for oral cancer, government-based oral cancer hospital. So I would like to say, please get the number from internet. It is known as green corridor or green line or golden line, which is available everywhere, and only doctor can call there. Patient cannot call there, or they won't entertain you as a patient. So only doctor, you need to introduce yourself. I am a doctor and I am doing a patient which is suffering from certain disease.
Thank you so much, Dr. Mayu. Dr. Pranay Patel, would like to have a privilege to present the vote of thanks for today's event. We are having one question. We'll just wait. Somebody wants to ask the question. Please raise your hand. Okay, no questions. So, to begin with the vote of thanks, first of all, I would like to thank the Almighty for giving us the strength and blessings to organize today's events. I would like to thank our principal, Dr. Pankaj Baike ma'am, and the management of KJ Mehta TB Hospital Trust to give us the constant support and the platform to organize such an event. I would like to express my sincere gratitude and thanks to our guest speaker, Dr. Mayur Mishra, who has spent his time for the today's event and share the valuable knowledge in the form of various form of tobacco, the recent tobacco products and the harmful effects pertaining to that. What are the Indian policies and what are the treatment modalities offered by the government and what steps we need to take to make it a success to unmask the tobacco industries. Thank you so much, Dr. Mayur. It's my privilege to present the certificate of appreciation for your valuable lecture for today's event. Please accept the certificate. Thank you so much, Dr.
Thank
Mayur.
you, sir, for providing me this opportunity, sir. You, Pankaj ma'am, the academic staff of College of Dental Science and administrative staff. Thank you all. And special thanks, not thanks, my regards to Mandeep sir, who is always giving me an opportunity to do newer thing in life, who taught me ABCD of academics. Thank you, sir, Mandeep sir. It means a lot to me.
My sincere thanks to
Thank you,
the
Pranav sir,
organizing
for
team, Dr. Mandeep sir,
certificate.
Dr. Tarun, Dr. Rohit, Dr. Maitri for their constant and untiring efforts to make this event a successful one. I would like to thank the IT department boards, Mrs. Ankita and Mr. Deval, as well as our PG students, Dr. Hirva and Dr. Chitisha, and all the interns and junior students and non-teaching staff for their constant support to make the event successful. A big thanks to all the wonderful participants for being part of today's event. Lastly, just would like to thank that and give a message that say no to tobacco and just say yes to the life. So have a good evening and have a good time. Thank you all. I will conclude the event. Bye now.
Thank you, sir. Thank you, sir. And extremely sorry, student, I have taken more time. Thank you, sir.
With this, we conclude today's webinar. Thank you to all our dignitaries, speakers, faculty members, students, and participants for joining us. Have a great day ahead. Thank you so much.